CNA Practice Test, Final Test Number 1 Multiple Choice, 2026. Question 1. Which of the following are potential areas likely to break down and result in a decubitus ulcer? A. Lungs. B. Heels and buttocks. C. A stomach. D. A fingers. The correct answer is heels and buttocks. Bony prominences like heels and buttocks are under the most pressure and are susceptible to skin breakdown. Question 2. When you are listening for a blood pressure, the first clear sound you hear is the A. Diastolic pressure. B. Prehistoric pressure. C. Antistolic pressure. D. Systolic pressure. The correct answer is systolic pressure. The first tapping sound heard, Korokov phase 1, indicates the systolic pressure. Question 3. CPR stands for A. Cardiopulmonary restrictions. B. A cerebral pulmonary resuscitation. C. Cardiopulmonary resuscitation. D. Cardiopulmonary post-resuscitation. The correct answer is cardiopulmonary resuscitation. CPR stands for cardiopulmonary resuscitation. Question 4. An environment that is most conducive to microorganism growth is A. Light, airy, cold. B. Hot and light. C. Warm, moist, dark. D. Cold, dry, dark. The correct answer is warm, moist, dark. Bacteria and other microbes thrive in warm, moist, and dark environments. Question 5. The brachial pulse is located at the A. Wrist. B. Elbow. C. Neck. D. Ankle. The correct answer is elbow. The brachial pulse is felt in the antecubital fossa, inner elbow. Question 6. The coccyx is the A. A tailbone. B. Heel. C. A hip. D. Shoulder blade. The correct answer is tailbone. The coccyx is the medical term for the tailbone. Question 7. The HIV virus can cause many problems, but the basic underlying problem is damage to the body's A. Cardiac system. B. Nervous system. C. Gastrointestinal system. D. Immune system. The correct answer is immune system. HIV attacks the body's immune system, specifically CD4 cells. Question 8. The U.S. Department of Agriculture guidelines for a healthy diet recommend that your plate should include A. 50% high-protein foods. B. 50% fruits and vegetables. C. 60% grains. D. 50% dairy products. The correct answer is 50% fruits and vegetables. My Plate guidelines recommend filling half your plate with fruits and vegetables. Question 9. When doing a bed bath, you start by bathing the A. Genital area. B. Hands. C. Feet. D. Area around the eyes. The correct answer is area around the eyes. You start at the cleanest area, the eyes/face, and move down to the dirtiest areas to prevent cross-contamination. Question 10. Avoiding touching body fluids, using disposable gloves, and good hand washing are examples of A. Standard precautions. B. Risk management. C. NPO precautions. D. Incontinence measures. The correct answer is standard precautions. Standard precautions are the minimum infection prevention practices used for all patient care. Question 11. To relieve edema, the nursing assistant should A. Elevate the patient's legs, B. Encourage mobility if possible, C. All of the above, D. None of the above. The correct answer is all of the above. Elevating legs uses gravity to reduce swelling, and mobility improves circulation. Question 12. Two blood-borne pathogens are A. Hepatitis B and Streptococcus B, HIV and hepatitis B, C. E. coli and Staphylococcus D, influenza and tuberculosis. The correct answer is HIV and hepatitis B. HIV and hepatitis B are viruses transmitted through blood and body fluids. Question 13. Which of the following may prevent a hand contracture? A. A splint, B. A hand roll, C. Range of motion exercises, D. All of the above. The correct answer is all of the above. Splints, hand rolls, and exercise all help maintain hand position and joint mobility. Question 14. When you count respirations, A. An inspiration and expiration count as 1B. An inspiration is counted as 1C. An expiration is counted as 1D. You count for 10 seconds and multiply by 10. The correct answer is an inspiration and expiration count as 1. One respiration cycle consists of one breath in, inspiration, and one breath out, expiration. Question 15. Patients susceptible to development of decubitus ulcers include A. Incontinent patients, B. Obese patients, C. A very thin patients, D. All of the above. The correct answer is all of the above. Moisture, pressure from weight, or lack of padding on thin patients all increase ulcer risk. Question 16. Range of motion exercises should be performed A. Once daily, B. Twice daily, C. 3 times daily, D. Only when the patient asks. The correct answer is twice daily. Standard practice is usually at least twice daily to maintain joint mobility. Question 17. The abbreviation HS means A. Bedtime, B. Lunchtime, C. A vital signs, D. Level of activity. The correct answer is bedtime. HS stands for insomnia, meaning at bedtime. Question 18. A patient should be checked for dryness and slash or toilet every A. 1 hour, B. 2 hours, C. 3 hours, D. 4 hours. The correct answer is 2 hours. Checking and changing every 2 hours prevents skin breakdown from incontinence. Question 19. Hepatitis B virus can be transmitted through A. Blood, B. Sexual contact, C. Both A and B, D. None of the above. The correct answer is both A and B. HBV is transmitted via blood, semen, and other body fluids. Question 20. You should avoid direct contact with body fluids. The body fluid that is most dangerous for transmission of HIV is A. Blood, B. Urine, C. Tears, D. Sweat. The correct answer is blood. HIV is primarily transmitted through blood. Concentrations in urine, tears, and sweat are negligible. Question 21. An unconscious patient should have oral care every A 4 hours, B 30 minutes, C 1 hour, D 2 hours. The correct answer is 2 hours. Frequent oral care keeps the mouth moist and prevents infection in unconscious patients. Question 22. When dealing with a resident with dementia, it is important to A. Speak loud, B. Speak in a clear, concise, easily understood manner, C. Speak to them as if they were a child, D. Use complex medical terms. The correct answer is speak in a clear, concise, easily understood manner. Clear and simple communication helps reduce confusion and anxiety. Question 23. When should you not take an oral temperature? A. The resident is unconscious, B. The resident is using oxygen, C. The resident has history of seizures, D. All of the above. The correct answer is all of the above. Oral thermometers are unsafe or inaccurate in these situations. Alternate sites should be used. Question 24. A footboard is helpful in decreasing the possibility of A. A foot drop, B. Calluses, C. Paralysis, D. Sore feet. The correct answer is foot drop. A footboard keeps the feet in a dorsiflexed position to prevent plantar flexion contractures, foot drop. Question 25. The Heimlich maneuver is used when a person A. has an airway obstruction, B. is in cardiac arrest, C. has contractures, D. has a concussion. The correct answer is has an airway obstruction. The Heimlich maneuver forces air out of the lungs to dislodge an object blocking the airway. Question 26. You have taken vital signs for your 60-year-old patient, Temp 101F, BP 162/96, RESP 16, Pulse 106. Which vital signs were abnormal? A. A pulse only, B. A respirations only, C. Temp and BP, D. Temp, pulse, and BP. The correct answer is temp, pulse, and BP. Temp 101 is fever, BP 162/96 is hypertension, and pulse 106 is tachycardia, are all high. RESP 16 is normal. Question 27. Which of the following statements about restraints is false? A. They can be applied when the nursing assistant thinks they are necessary. B. They can be applied only if ordered by the physician. C. They must be released at least every 2 hours. D. They are a last resort for safety. The correct answer is they can be applied when the nursing assistant thinks they are necessary. NAS cannot independently decide to apply restraints, a physician's order is legally required. Question 28. What is the normal daily fluid intake range for an adult? A. 500 to 1000 cubic centimeters, B. 1500 to 2000 cubic centimeters, C. 2500 to 3000 cubic centimeters, D. 4000 to 5000 cubic centimeters. The correct answer is 2500 to 3000 cubic centimeters. 2500 to 3000 cubic centimeters is the standard recommendation for daily fluid intake to maintain hydration. Question 29. What is the normal pulse rate range per minute for an adult? A. 40 to 60 beats per minute, B. 60 to 100 beats per minute, C. 80 to 120 beats per minute, D. 100 to 140 beats per minute. The correct answer is 60 to 100 beats per minute. A normal resting heart rate for adults is 60 to 100 beats per minute. Question 30. What is the normal respiration rate range per minute? A. 8 to 12 breaths per minute, B. 14 to 20 breaths per minute, C. 25 to 30 breaths per minute, D. 30 to 40 breaths per minute. The correct answer is 14 to 20 breaths per minute. Normal respiration rate is typically 12 to 20 or 14 to 20 breaths per minute. Question 31. Another name for a decubitus ulcer is A. Arterial ulcer, B. A venous stasis ulcer, C. Pressure sore, D. Diabetic foot ulcer. The correct answer is pressure sore. Decubitus ulcers are commonly known as pressure sores or bed sores. Question 32. The medical abbreviation QID means A. Once a day, B. A twice a day, C. 3 times a day, D. 4 times a day. The correct answer is 4 times a day. QID stands for quarter in die, which means 4 times a day. Question 33. Incontinence is defined as A. Excessive urination, B. Inability to urinate, C. Lack of control over urine and / or bowel functions, D. Painful urination. The correct answer is lack of control over urine and / or bowel functions. Incontinence is the involuntary leakage of urine or feces. Question 34. The medical abbreviation NPO means A. New patient order, B. Nothing by mouth, C. No physical output, D. Nightly pulse only. The correct answer is nothing by mouth. NPO stands for nil per os, meaning nothing by mouth. Question 35. The term post-mortem refers to A. Before surgery, B. During surgery, C. After recovery, D. After death. The correct answer is after death. Post-mortem care is the care provided to the body after death. Question 36. A prosthesis is A. The type of bandage, B. An artificial body part, C. A prescription medication, D. A surgical instrument. The correct answer is an artificial body part. A prosthesis is an artificial device that replaces a missing body part. Question 37. CVA is the medical abbreviation for A. Cardiovascular attack, B. Cerebrovascular accident, stroke, C. Central venous access, D. Cardiac valve arrest. The correct answer is cerebrovascular accident, stroke. CVA stands for cerebrovascular accident, commonly known as a stroke. Question 38. The medical abbreviation Q stands for A. Quiet, B. Quick, C. Every, D. Question. The correct answer is every. Q is used in medical notation to mean every. Example Q2H equals every 2 hours. Question 39. Hands should be washed after removing gloves. A. True, B. False. The correct answer is true. True. Question 40. Range of motion, ROM, exercises should not be stopped at the point of pain. A. True, B. False. The correct answer is false. False. Question 41. You should use your thumb to feel a patient's pulse. A. True, B. False. The correct answer is false. False. Question 42. The toenails of a diabetic patient should be trimmed only by a nurse or podiatrist. A. True, B. False. The correct answer is true. True. Question 43. All patients can safely be put in the prone position. A. True, B. False. The correct answer is false. False. Question 44. Dentures should be stored wrapped inside a paper towel on the nightstand. A. True, B. False. The correct answer is false. False. Question 45. A blood pressure of 200/110 should be reported to the charge nurse. A. True, B. False. The correct answer is true. True. Question 46. If a patient has fallen to the floor, the nurse must be notified immediately before the patient is moved. A. True, B. False. The correct answer is true. True. Question 47. When doing good pericare, it is important to wipe from back to front. A. True, B. False. The correct answer is false. False. Question 48. A graduate is used for measuring fluids. A. True, B. False. The correct answer is true. True. Question 49. Blood pressure is the force of blood pushing against the walls of the arteries. A. True, B. False. The correct answer is true. True. Question 50. Documentation on the resident flow sheet can be done in pencil. A. True, B. False. The correct answer is false. False.